those you live with and those that you love. You need to get tested quickly, and you need to get tested as often as you need to get tested, even if after your initial tests, a day, a week, you develop other symptoms. It helps our public health team, our contact tracers, all to get ahead of this. And more importantly, it reassures yourself, those you live with and your family that you are safe. We do know that over the course of this pandemic, so many Victorians have given up so much for us to be safe and to have, on global terms, a pretty sensible and safe set of circumstances in this state. But it's always at risk. It's always precariously balanced, and we are in that position today. There are many, many things that we could all do to make sure that we stay safe and bring that balance back into the kind of life that we want to return to. There are a million things that we miss about our life pre-pandemic, and those are the million reasons that we all need to get vaccinated. Vaccinations are a really, really important part of getting our pathway out of this pandemic. And that's why 29,490 vaccinations were delivered in state-run clinics yesterday, another record day for our state clinics. And that is the important first step for our goal of 1 million doses in 1 million arms over these coming 5 weeks. We're adding more vaccination centres. We're expanding the capacity of existing centres with more booths. And our booking system is constantly, as more supply comes on board, being updated to accommodate that new supply. To further meet the increased demand that we're seeing from Victorians to come forward and get vaccinated, we will be establishing more drive-through sites, particularly in the north, in the Wyndham area, in Melbourne's southeast, and in the north in the Hume-Whittlesea area. So it's our north, our west and our southeast suburbs that the drive-in centres, which have gone so well in its first week in Melton, will be expanded. We've seen demand for AstraZeneca, particularly from young people, increase in numbers over the past week, and that's why we've now expanded that to everyone aged from 18 to 39, and I want to thank them for coming forward in record numbers for their first AZ jab, and we really do encourage people in that group to get on board, book yourself a time. Of course, the alternative is through our primary healthcare networks, our GPs, and starting very soon our community pharmacies. Victorians are getting informed, they are rolling up their sleeves, and they are getting vaccinated in increasing numbers, and we want to see more of that. We want 1 million jabs in these coming 5 weeks. And today's 21 cases show us why that is so important. 15 of the 21 cases are linked to the Glenroy outbreak that we've indicated growing concerns about over recent days. 10 cases are across 3 households linked to the Glenroy West Primary School. 2 students and 1 staff member at Glenroy West Primary are also amongst those 15. 1 household contact of an existing student case and 1 student case from a school in Laverton who rode a bus supervised by one of the previously reported Glenroy cases. So that's our 15 in the Glenroy component of the outbreak. 3 cases are linked to Altaqua College, 1 student, 1 staff member and 1 household contact of a known case associated with that cluster. That brings us to 18. 2 cases are linked to the city of Hobsons Bay, the Newport outbreak. 2 household contacts from 2 different households, and these are contacts from 2 different players who attended the Newport versus West Footscray footy game. That brings us to 20, and there is 1 final case who is a household contact from a previously reported Caroline Springs Square shopping centre case. So that's our 21. But what we have seen as a result of these growing numbers of people every day is that we have multiple outbreaks with multiple exposure sites right across Melbourne. And whilst we have genomic links, we still don't have a source of infections for a number of these positive cases. Our public health teams are progressively tying them down and tying them together and managing the close contacts of an increasing number of primary close contacts right across metropolitan Melbourne. And we know that these are cases that might well have been out in the community and might well be linked to unexplained change of transmission, hence our call for more people to get tested. Kate will go further into detail about those public health responses and tracking down those change of transmissions, but just to reinforce, the most important thing we can all do, either as we've been to those exposure sites, linked to them, is to get ourselves tested, and more broadly, no matter where you are in Victoria, if you show even the most mild of symptoms, please come forward and get tested. And in regards to unexpected detections of COVID-19 fragments in wastewater testing in both metropolitan Melbourne and regional Victoria, we did report Sunshine West, Glenroy, Broadmeadows and Williams Landings as showing positive detections, and there have been new regional detections in the Shepparton regions. The Shepparton catchment includes the suburbs of Shepparton, Kilala and small parts of both Shepparton North and Orvale. Anyone who lives, works or has visited these areas from the 9th to the 11th of August should get tested, and of course as soon as possible, if anyone shows any symptoms in these areas, that they should also get tested. Extra testing is now being established in these parts of the Goulburn Valley. The Goulburn Valley Health Acute Respiratory Clinic in Graham Street, Shepparton, where opening hours are from 8 a.m. to 4 p.m. 7 days a week, and additional staffing has been provided for that centre over the course of this weekend. We did also report detections in Lakes Entrance yesterday. And the Lakes Entrance catchment includes the local areas that pick up Lake Entrance itself, Lake Boonga, Calaman, Lake Tyers and Lake Tyers Aboriginal Trust. Anyone who again lives, works or has visited these areas from the 8th to the 11th of August should be on alert for symptoms developing, and of course the wider community needs to also monitor for any symptoms. As a result, extra resourcing is on place for 3 sites in the Bairnsdale and Gippsland Lakes area, the Bairnsdale Regional Health Service drive-through, the Bairnsdale Respiratory Clinic, which is a Commonwealth clinic, which is by appointment only, I should stress that, and also the Gippsland Lakes Community Health Centre, which is also by appointment only. The people of that region, having been here before, I'm sure know the arrangements in place and will strongly support them. Testing is where we know we get ahead of where this virus is travelling. It's where our public health team and contact tracers and our local public health units get to monitor what is going on in these communities. And more importantly, it's the key tool in limiting the spread and making sure we run down this outbreak. I can't stress enough, please come forward and get tested. It's the singular most important thing you can do. Other than getting vaccinated, they're two sides of the one coin. We really do need more people to come forward and get tested, and we need Victorians to come forward as part of that 1 million vaccinations over the next 5 weeks. I'll ask Kate to go into more detail, and then we're happy to take questions.
Thank you, Minister, and good morning. There are currently over 14,000 primary close contacts across Victoria related to this outbreak. We have cleared over the past couple of days 650 close contacts from our earlier outbreaks. And yesterday, our household engagement program conducted a record number of visits across Melbourne and close contacts in Victoria, 1,277 visits. I thank our hard-working teams of authorised officers as well as the support provided by the Australian Defence Force. Thank you all for conducting that program. Our teams conducting that program have seen strong compliance with isolation from those close contacts and cases, and again, I thank those 14,000 people across Victoria for doing the right thing. These cases and contacts live and travel across multiple suburbs and have generated exposure sites all across Melbourne, including some of our busiest shopping centres. We now have over 450 public exposure sites listed on our website, and people who've been keeping an eye on that website will have seen the number grow day upon day. We are very concerned by what we're seeing across Melbourne. Our cases from the City of Melbourne, Glenroy, Melton South, Middle Park, Newport, West Footscray, West Brunswick and Wyndham Vale still do not have identified sources of acquisition, although our teams are constantly reviewing the data, re-interviewing for information and trying to make those links. Of course, genomics may also help in identifying those links. I'm pleased to report that that work has linked a case from yesterday that we reported as unlinked. So the Roxbrook Park case from yesterday has been linked to the Glenroy West Primary School outbreak. That's a good start, but we will obviously continue to work through those linkages. Glenroy is a big focus of ours. As the Minister reported, we have 15 new cases linked to the Glenroy West Primary School outbreak, and that's a total now of 22 cases across 8 households. We have 345 primary close contacts who have been asked to isolate, and 1/3 have already returned negative tests, and I would expect another increase of test results to be returned today. We've got one case who attends Corpus Christi Primary School in Glenroy. They've generated 45 primary close contacts, and that is a much smaller number because of the lockdown we have in place. The wastewater detection system has recorded multiple positive readings, and we've been calling that out over the past few days. If you live or have shopped in the Glenroy, Jacana, Broadmeadows areas lately, please check the website for exposure site details. And as always, if you have symptoms, please come forward and get tested. We've got great testing capacity in Glenroy, 23 testing sites within 10 kilometres. The wait times in that area are pretty reasonable, but if one site does get additional demand, we do have active diversions in place, as well as the wait times listed on our website to try and provide more information for you to help you get tested quicker. This outbreak is affecting multiple areas of Melbourne. The Melton High Street shopping strip has identified 250 close contacts, and we have results back for 2/3. There are over 3,000 primary close contacts linked to CS Square in Caroline Springs, and we have negative test results for 85% of those. The Middle Park case, only announced yesterday, has already generated over 100 close contacts. We've got cases who are essential workers who have travelled all over Melbourne, and in the past few days we've now listed dozens of exposure sites in the eastern and southeastern suburbs of Melbourne. Thank you for those who are keeping an eye on our website and really keeping an eye on those exposure sites. If you've been to one, please act on the public health advice relevant to that exposure site. It could be Tier 1, it could be Tier 2, and if it's a Tier 2, you just need to get a test and isolate until you have that negative result. Again, thanks to those thousands of Victorians who are Tier 1 primary close contacts and isolating for the full 14 days. Our community engagement-based model has been helped by the extraordinary patience of those who have been affected and caught up in these outbreaks. And again, thank you to the community leaders and school communities who've been engaging with us over the past week or two. I'd like to reiterate the Minister's message and our message over the past few weeks: please get tested. Our teams get on top of the cases and clusters that we know about. If we don't know about it, we can't get on top of it. We can only find cases by people coming forward for testing, and I thank you for doing so. We are concerned the virus is in areas of Melbourne that we don't know about yet. New cases have been emerging, and we have a number of unlinked cases. Again, please limit your movements. If you can work from home, please work from home. Don't attend your office. Don't have multiple people attending an office. We're very lucky to have digital and, Teams, Zoom, all these technologies to help us work from home if you can work from home. Please don't visit family or social contacts. If you have symptoms, please don't wait. Don't assume it's a cold, and a reminder of what some of those symptoms are. If you've got a cough, a sore throat, a runny nose, aches and pains, loss of smell or taste, or even a headache or gastro symptoms, please don't assume it's something else. Please come forward and get a test. It's the best way for us to be able to get on top of these outbreaks and live a life out of lockdown. I'll pass to the Minister for questions.
Minister, a Richmond apartment complex was listed as a Tier 2 exposure site yesterday. This dates back to August 2, which is 2 days before we learned about the first Al-Taqwa case.
Yes.
Can you provide a bit more information on this and outline whether it's linked to the old outbreak that sparked the last lockdown?
It's linked to the Glenroy cluster at the moment, and further work is underway. The genomics and other evidence, but there's nothing to suggest that it's linked back, as you say, at this stage to the earlier outbreaks.
Given that the site is close to MCG, Amy Park, Miss Frankie's, is there any link to any of those sites?
Again, there's work underway, but there's nothing that links those two cases at the moment.
Can you give us more information on this case?
Beg pardon?
Can you give us a bit more information on the case?
Well, there's
the
the exposure sites that are listed. It's a residence of a positive case linked to the Glenroy West primary outbreak.
Minister, we've seen the number of mystery cases in the recent days causing concern. Can you run us through how many actually remain a mystery?
Kate did list them. I might get her to list them again, but as the testing teams, as the contact traces and as the evidence comes in, some are being closed up and linked. But there's quite a number, and that's a really big concern, and that's where getting our testing numbers up, particularly in those exposure sites that are increasingly going up on the website, will help us draw those links. I can happily get Kate to list them again for you, but there's quite a number. Kate, do you just want to go through those?
We currently have 8 unlinked cases, and those are the cases from City of Melbourne, the original Glenroy case, Melton South, Middle Park, the original Newport from a week or so ago, West Brunswick, a case in Wyndham Vale, and again the original West Footscray case from last week. And
the point of transmission that's actually prompted this outbreak that's put us back into lockdown, is that still a mystery as well?
So the original Newport case, yes, from. Again, at this stage, unfortunately, we don't have epidemiological links back to anything. Genomics shows it's one of two things. It may be related to the original Coolaroo outbreak, or it could be a separate incursion from New South Wales.
The original Coolaroo outbreak, can you just remind us what that was?
Yes, that was a red zone returnee who had returned from Sydney at the time before it was an extreme risk zone, and that outbreak spread across 5 households.
We were told that wasn't linked because it wasn't genomically linked, is that right, or is that still a line of investigation?
Sorry, I don't think that's correct. Can you repeat that?
We were told that was ruled out. Was that not ruled out?
No, I don't think we've said that. There's still two possibilities. One is a possible link to Coolaroo, and one is a possible New South Wales incursion.
We're about 10 days into the lockdown now. How is it, do you think, that we're still recording these mystery cases? Are these people who are the mystery cases, have they been going out a lot? Are they essential workers? Are they going to supermarkets and things like that?
Well, of course, everyone needs to be able to shop for food and groceries. There are those 5 reasons to leave home. You need to be able to provide food or medications and get your essentials. There are, of course, essential workers who are able to move about the city. They might be stocking our supermarket shelves. They might be nurses in our hospitals, and so on and so forth. But the thing I'll really reiterate is we won't have unlinked cases if people come forward to get testing as soon as they possibly can, at the earliest signs of symptoms. If you know that you've been to an exposure site, please don't wait for tomorrow. Please come forward and get that test now.
Is that a problem that you're seeing then? People going for several days with symptoms before getting tested?
Oh, there's no particular concerns there that we do have, but as mentioned, there's a case that dates back to the 2nd of August today. So there are, various people who, for various reasons, may think they don't need to get a test. Other people are asymptomatic, and we only find them because of clusters or outbreaks, and we test that community, such as a primary school. So it could be various reasons.
What's the mix of children in these cases now? You mentioned a number that are now linked to primary schools in these new ones. How many kids do we have infected? I
don't have the exact breakdown of adults versus children, but there are a large number of children. We're seeing this elsewhere as well. I know that in ACT there's been a primary school aged child. Delta seems to, unfortunately, love children. We know children also they play, they come into close contact with each other. So Delta does spread amongst children, and then, of course, as we know, it gets into households and teachers and other parts of the community.
Talking about the spreading of children, a group of 80 parents from the Heathdale Christian College were told that they could do like a priority walk-up testing at the Wyndham Hub, but they were knocked back this morning. The school principal's spoken out about it being unfair and frustrating. Do you know why that's happened?
Is that testing or vaccination?
Testing.
I don't have any information for that. Certainly where there's primary close contacts, they are prioritised for processing at the lab. So the pathology end, they're prioritised. Unfortunately, we don't have systems at our testing sites to be able to move people to the front of the queue. And I do ask people to be patient when they go forward to get testing.
Are you able to provide us with some more information on this Richmond case, their age, where they worked, whether they're an essential worker, and also why they waited to get tested?
As you know, we are very conscious of being able to maintain people's privacy. Our cases and close contacts all do have a right to privacy. As the Minister mentioned, this case in Richmond is linked to Glenroy West Primary School.
Did they take too long to get tested? Is that a concern here?
No, not that I'm aware of. That case has been extremely helpful and forthcoming with all the contact tracing interviews thus far, and I really do thank them for their support.
But in terms of when they were symptomatic, when they got tested, what's the timeline of all of that?
I don't have that information to hand.
Minister, 466 cases in New South Wales today. 6 week in, cases are still going up. People in Sydney can go out for an indefinite time to hang out with one friend. Some shops are still open. Are they following an aggressive suppression strategy, do you think?
Well, the situation in New South Wales is really concerning to not just the people of New South Wales, I'm sure, increasingly rural and regional New South Wales, but all Australians. We need New South Wales to take all the measures that they have to take to get their numbers down. Victorians know that more than anyone. We've been there. And we know that tough measures drive down the infection rates. And we've seen the New South Wales genomic links into Victoria. We've seen it into Queensland. And it's a concern for every state and jurisdiction. Now, of course, we've seen it in the ACT. What we need to make sure is that New South Wales win their fight and that they take all the necessary stringent measures to drive those numbers down. we also need to take all the stringent measures that we have to take to drive those numbers down.
Minister, do you welcome the CSL plan to build the 2 facilities to make the COVID vaccines here in Melbourne? And do you think the federal government needs to fast-track that plan?
What are we now, 18 months in to the global pandemic, and the mRNA technology is one of the really shining lights of how not just getting on top of COVID, but a whole heap of other both virus-related and indeed cancer and a whole heap of treatments. Victoria is the home of Australia's and indeed this part of the world's biotech industry. We've got the research, the labs, and we've got the manufacturing capacity. That's why the Treasurer put $50 million on the table as part of the program to attract mRNA technology into Victoria. And I understand the Commonwealth are partnering with the state to look at how we can bring that forward as quickly as we possibly can. Victoria also has, right now, Monash through its pharmaceutical department, doing the first stage trials of what mRNA local technology would be. Victoria is the home of our biotech industry, and it's the logical place for this investment to take place.
Minister, obviously it's a beautiful day today. There's lots of people out and about. Last night and on the weekends, we're sort of seeing lockdown fatigue, people going to bars, being outside but still getting takeaway cocktails, hanging out in groups, that sort of thing. Do you have a message for people who may be having lockdown fatigue and wanting to get out and about?
We're all sick of this pandemic, and we all want it to be over. But it will be over by following the rules, getting vaccinated and getting tested. The important 5 reasons to leave home and the duration in which you can leave home in metropolitan Melbourne are still there for good reason. All of the exposure sites, all of the increasing number of primary close contacts that Kate just took us through are a result of community transmission. By all means, follow the rules, enjoy the allotted time in which you can be outside, but don't congregate. There are limits on how you can gather, and that's because the virus loves a crowd, and the virus will transmit through crowds. So please, you must wear your mask outside. You must wear your mask in situations where you come in contact through the essential reasons that you are allowed out. But enjoy the good weather by all means, but follow the rules and keep our community safe.
Does weather like this make it more difficult, though, to keep Melburnians in Melbourne and regional Victorians in regional Victoria, given they've got those extra freedoms?
No, not automatically. I think, particularly given VicPol's Operation Sentinel, which has been very effective in terms of its technology-driven, its fast-moving mobile patrols, which will make sure that if you do want to take that risk, that you run a very good chance of being apprehended and fined. But I think there's a balance there that Victorians know that by following the rules, we've demonstrated that we can drive these outbreaks down. And we can do that again. By all means, you're allowed a reasonable period of exercise outside, gathering in parks, but do not gather in numbers. Enjoy the time, but please follow the rules.
Minister, is the target of the 1 million vaccinations, the injections, do you think that's ambitious enough? We saw 29,000 yesterday. If my calculations are right, it's more than we need a day to make that target. Have you been ambitious enough?
We want to make sure that the ambition we set, which is pretty challenging when you look back at where we've been and the amount of supply that we've got coming on board, it's a big challenge. If we can get there earlier, fantastic, but it's a big challenge, and what we need is particularly those younger people, 18 to 39s, to come forward. We also need people who are already eligible, 50 and above, in a particular category, to come forward and get tested. Every day there will be more slots booked in as we get more and more certainty of supply from the Commonwealth. In coming weeks we will see more Pfizer become available. In coming weeks we've been assured that Moderna will soon become available. We will see more distribution points through our GP networks, I'm sure, and through our pharmacy networks. And I'm sure we will see our primary care providers step up and be, in addition to the 1 million that the state-run clinics are aiming for, to do more. And I think an ambition to achieve that 1 million is ambitious, but it's also achievable.
Well, that into that AstraZeneca availability being increased, do we know how many people under 40 have actually taken up that challenge?
We can get that to you. I'm sure it's available, but I don't have it with me at the moment.
Have you been impressed, though, by what you've seen with the number of people making bookings and also getting their jabs?
We've seen yesterday the figure was threefold the amount that it was for the same period the previous week. So a 300% increase in people coming forward in that age group, overwhelmingly through AstraZeneca appointments, overwhelmingly first appointments, is a really significant effort.
Just on New South Wales again, Minister, did you get an update on how discussions went at National Cabinet yesterday around that New South Wales outbreak? And would you like to see some more firm commitments come out of National Cabinet in terms of actually getting that outbreak under control?
I think the Prime Minister gave an update on National Cabinet yesterday afternoon, and discussions with our Premier indicated the same thing, that everyone signed up again to the national strategy, and that requires 0 or low cases for the 70% and 80% arrangements as part of the Doherty modelling as we start to vaccinate substantial numbers of Australians. A key part of that is low outbreaks, low infection numbers, and Victoria has to do its bit, Queensland has to do its bit, every state and territory has to do its bit. The biggest challenge is clearly New South Wales, and I would encourage New South Wales to take all the measures it needs to drive those numbers down.
So is it your understanding that that 70% target could be in jeopardy if there is still hundreds of cases happening in New South Wales?
Well, I'll just refer you to the Doherty material, the modelling that has been released that has underpinned the national phase strategy that the Prime Minister has released, and which is supported by the COVID Shield vaccination program that Lieutenant General Fruin has released. They all point to the basis on which that strategy is built, and that is high vaccination levels and low community transmission.
And as long as these cases are going on in New South Wales, how does that impact your government's decisions around lifting lockdown and easing restrictions, where you're going to have to be more cautious as the cases go up there?
Well, we'll take the public health advice in terms of the circumstances on the day-by-day evolution of how this pandemic plays out. We've seen cases rise in New South Wales. The figure you gave me before is I'm guessing the highest figure that they've seen so far. Victorians know how tough it is to drive down those numbers. The model that we used last year, the role that masks play, the role that restrictions play, they're really tough, but they're really important because they work. The difference this year is that we have the added possibility of a really substantial pathway out through high levels of vaccination. It's not one or the other, it's both.
Minister, do you think that we could still have lockdowns and border closures? Do you think we could still have lockdowns and border closures even past 80% vaccination, given the outbreak in New South Wales?
Well, I'll just refer you to the Doherty modelling and the material that First Ministers have signed off on, and we know that once we get to 70 and then 80% vaccination levels right across the country, our options for a pre-pandemic, something that looks like COVID normal life, increase hugely. I'm really looking forward to that Boxing Day test. I'm really looking forward to a beach holiday one day, and I know that that will be part of the vaccination program when we get 70 and 80% of Victorians vaccinated. it's up to every state and jurisdiction to do its part with the Commonwealth to make sure that the building blocks of the Doherty modelling are able to be achieved in reality. High levels of vaccination, high levels of testing, and low levels of community transmission.
So what's your thoughts on the WA Premier Mark McGowan not allowing people into Western Australia from New South Wales unless they've had at least one vaccination? Would you be supporting a system like that for Victoria?
Well, that's a matter for Western Australia, and Western Australia have been exceedingly successful in managing virus numbers and its importation into its state. The Nullarbor Plain helps a bit, I'm sure. Unfortunately, Victoria has a really active and dynamic border with New South Wales. We're the two biggest states in the Commonwealth. We're the two biggest economies. We've got border communities that are essentially the one community. But those kind of measures about what role vaccinations play in better and free movement across the country, that will be part of a conversation again that National Cabinet has signed off on, and which Victoria, Tasmania and the Northern Territory together with the Commonwealth are working up. So I've got no problems with our Western Australian friends putting in place, if you like, the first iterations of what will be over time a freer vaccination-driven model of movement around the country.
With regards to that border, over the border in Albury, we've got a quarantine campground of sorts where Victorians are sort of pitching their tents or setting up their caravans because they can't get back in over the border. What sort of time period are they going to have to be waiting before they can get back across?
Look, I can't give those people any commitments as to what their particular circumstances are. We've had 12,000 applications from people, Victorians and people, citizens of New South Wales, wanting to enter Victoria. We are prioritising those end-of-life and critical medical care decisions, as I think Victorians would expect us to. That's running at about 6 or 7% of those 12,000 having been approved. And there are heartbreaking reasons as to why other applications aren't being approved. But they're not being approved because the situation in New South Wales deteriorates by the day. The figures that you just shared with me about New South Wales' current infection rates from yesterday, the fact that without a ring of steel, we've seen far western New South Wales, Byron Bay, the ACT, the South Coast, Dubbo, all sorts of places that just a matter of days ago were COVID-free are now being caught up in the spread of the virus out of Sydney. That the virus got out of Sydney into Victoria. It got out of Sydney into Queensland, and now it's well and truly across regional New South Wales. And as tough and as personally disturbing it is to see some of the really heartbreaking cases being declined, it's sadly for a really good reason. We do not want to be where New South Wales is. We will continue to work through cases, but if you just, I've got to be frank, if you are coming for non-urgent work-related reasons, for recreational reasons, for reasons that could be best dealt with in New South Wales, your chances of getting approved are not very good. And we will continue to both expand the workforce. We've expanded it tenfold that are going through the exemptions processes, but they are tough because they need to be tough on public health grounds.
Can you understand their frustration, though? There's footballers being allowed in to kick a ball around an oval, yet these people can't get back to their homes.
Of course I can understand their frustrations, and many of the cases are genuinely heart-rending and tear at you as to why people reasonably in their circumstances think that their case is really important. But when measured against people who are dying, who need to see family members before they die, or want their family members to see them before they die, or for funerals, or for end-of-life critical care measures. Necessarily, these have to be triaged first. All of these cases have to be signed off by a senior public health official. And whilst I have great sympathy for those exemption requests, I think Victorians would rightly hold us to account that should any of those 12,000 cases just be a tick and flick and let you come in, not only would we see many, many, many more people from New South Wales want to come into Victoria, but we would run the risk of what is happening now with infection rates in New South Wales being part of the Victorian community. And I'm sure no Victorian wants to see that.
Can you explain why the case of Katrina Anderson, why her exemption request was denied even after intervention from New South Wales?
I don't comment on individual cases because that wouldn't be appropriate. But I do understand that following a request from the New South Wales Government, a New South Wales citizens' application was reconsidered and the same outcome was arrived at, that as heartbreaking as it might be, that there are alternative available that don't require a citizen of New South Wales to come to Victoria, however that person might well have been getting here.
How far away do you believe it's going to be before we're having events and opportunities that are offered to people who are vaccinated versus those who aren't? And do you support that?
Absolutely, we support it. It's part of the national strategy that National Cabinet signed off based on the 4 phases that the Prime Minister and all the states and territories have signed up to. Victoria, the Northern Territory and Tasmania, together with the Commonwealth, are leading the work on that. I understand and that there was an initial report delivered to National Cabinet yesterday. More work is being done on that. There's lots of partners in both the private sector and the community sector and the sporting, cultural, arts communities, all of whom want to be part of that. And that's because there should be both positive reasons why we want to get vaccinated and the proof of that vaccination status allowing us to take up some of those positive reasons. But equally, if you're not vaccinated for reasons that haven't got to do with the very small number of people who are, through health reasons, can't be vaccinated, outside of that group, there needs to be a positive there needs to be a disincentive for those people to hang out as to why they don't want to be vaccinated.
How soon do you think that's going to be, though? Like by Christmas, are there going to be events that are run in that manner?
Well, that's a matter for the reports that need to go back to National Cabinet. But I think the Prime Minister and First Ministers have all indicated that certainly by the time we get to that 70% and 80% vaccination rates, that work needs to be part of the consideration of what does a better life for all of us look like on the other side of that. And I'm pretty sure on all the projections I've seen that that's certainly by Christmas.
And given it sounds like the level of unknown in the community at the moment with those mystery cases and wastewater detections, that sort of thing, previously we've said within 40,000 was the sort of testing rate, daily rate that we were looking for. Do we need to up that? I know we're falling well short of it yesterday. But
well, we've averaged 40,000 over the past week. We've exceeded that on many occasions over the past couple of months. We've almost pushed 58,000, 59,000 a few weeks ago. I'm confident that given the seriousness of the number of exposure sites that are growing, the number of personal close contacts and secondary contacts that are out there, and the number of as yet unlinked cases to an original acquisition source, we're managing to link them to other cases, yes, but it's those original acquisition sources that Victorians understand the seriousness of this and will come forward to get tested.
In terms of question, the need for a ring of steel at National Cabinet yesterday around. Did the Premier push for the need for a ring of steel around Sydney at National Cabinet?
I'm not a member of National Cabinet. You'd have to ask the First Minister.
Have you had discussions about whether that's something that's really being pushed on New South Wales?
Regular discussions with the Premier and other ministers as to what's the best approach to deal with containing incursions from New South Wales. New South Wales Government, we did call upon them to contemplate a ring of steel. They've declined that. That's why we have to have really one of the contributing factors as to why we have to have a really tough arrangement on the Victorian-New South Wales border, and sadly one of the reasons why we have to have really tough arrangements about people wanting to enter Victoria from New South Wales.
You mentioned the ring of steel. What other policy settings do you want to see in place from New South Wales to help drive down the infections there? And
well, it's not my job to tell another jurisdiction how to go about its business, but there's been lots of modelling done by, for instance, the Burnett Institute, by other modellers around the country that point to a whole range of measures that that any jurisdiction could consider as to how it drives down infection rates. I have seen reports that the New South Wales Police did a review of the New South Wales public health orders and have ramped up measures. I welcome any measure that helps drive down New South Wales infection rates, because New South Wales' fight is Australia's fight, and we can't have the level of confidence that the Doherty Institute's modelling that has underpinned the federal government strategy is capable of being delivered right around the country until all of us have achieved the kind of preconditions that the Doherty modelling is predicated on.
In terms of the wastewater detections in regional areas here, how on alert should those communities in Lakes Entrance and Shepparton areas be? Are the wastewater detections strong? What do you think might have happened there?
So we know that by assessing where our positive cases and primary close contacts are, that causes us to be able to